Welcome to our second video on water-soluble vitamins. Let's begin. Let's take a look at vitamin B6. Vitamin B6 is also known as pyridoxine and is found in meat, whole grains, vegetables, and nuts. It serves as a cofactor of transamination reactions. Interestingly, it can be used in the treatment of hyperemesis gravidarum. Risk factors for vitamin B6 deficiency include the use of isoniazid, which is why it is important to supplement with pyridoxine when prescribing this medication. Other risk factors for vitamin B6 deficiency include the use of oral contraceptives, alcoholism, and diseases such as sickle cell disease or Hodgkin lymphoma. Let's continue with clinical presentation. Vitamin B6 deficiency can present with peripheral neuropathy, seizures, and cheiliosis. It can present with sideroblastic anemia because vitamin B6 is involved in the heme synthesis pathway. The lack of vitamin B6 impairs the transfer of iron to hemoglobin, which in turn causes iron accumulation in red blood cells. This image shows ringed sideroblasts, a classic finding in vitamin B6 deficiency. Sideroblasts are nucleated erythroblasts with granules of iron accumulated in the mitochondria that surround the nucleus. Remember that these ringed sideroblasts occur in vitamin B6 deficiency due to the fact that vitamin B6 usually facilitates the transfer of iron to hemoglobin. Now we will cover the last vitamin of the B complex, vitamin B7. Remember that vitamin B9 and B12 are covered separately in our lecture on macrocytic anemias. Vitamin B7 is also known as biotin and can be found in liver, egg yolk, soybean, and dairy products. Vitamin B7 deficiency is rare. However, it can be present in patients who have used parenteral nutrition long term. Also, raw egg whites have avidin, which binds to biotin in the intestinal lumen and inhibits its reabsorption. Therefore, excessive consumption of raw egg whites is a risk factor for developing vitamin B7 deficiency. Vitamin B7 deficiency can also be found in patients treated with valproic acid. If a patient develops vitamin B7 deficiency, they may show clinical features such as dermatitis, enteritis, or alopecia. Let's continue with the last vitamin covered in this lecture, vitamin C. Vitamin C is also known as ascorbic acid and is found in fruits and vegetables. Let's continue with the risk factors for vitamin C deficiency. Malnourished patients, drug or alcohol abusers, the elderly, and chronically ill patients are mainly at risk. Now let's discuss the clinical presentation of vitamin C deficiency, which is also known as scurvy. It presents with swollen gums, perifollicular hemorrhages, coiled hair, ecchymosis, impaired wound healing, and signs and symptoms of anemia, secondary to decreased iron absorption. This image shows swollen gums that present in a patient with scurvy. The gums are usually swollen, painful, and prone to bleeding. Let's move on to vitamin C toxicity. Vitamin C toxicity may cause diarrhea, abdominal bloating, calcium oxalate kidney stones, and iron overload. A 34-year-old female presents to the emergency room with chest pain, chills, night sweats, and coughing up blood. She recently returned to the U.S. after a business trip to Indonesia. Vital signs include a heart rate of 115, respiratory rate of 22, temperature of 39.2 degrees Celsius, and blood pressure of 130/81, and 96% O2 saturation. Sputum culture grows acid-fast bacilli, and the patient is started on the appropriate antibiotic regimen. Which additional supplement needs to be prescribed along with the antibiotics? A 34-year-old female presents with symptoms of chest pain, chills, night sweats, and hemoptysis after a recent trip to Indonesia. Tachycardia, tachypnea, fever, and a lower O2 saturation are indicative of an active respiratory infection. The symptoms, travel history, and culture growing acid-fast bacilli should lead you to the diagnosis of active tuberculosis. The typical antibiotic regimen for active TB can be remembered with the acronym RIPE, which stands for rifampin, isoniazid, pyrazinamide, and ethambutol. As you may remember from earlier in the lecture, isoniazid leads to a deficiency of vitamin B6, which can in turn lead to a deficiency in vitamin B3. It is important to remember that vitamin B6, also known as pyridoxine, must be given with isoniazid to prevent this complication. A 47-year-old male presents to the emergency room because he is worried that a large cut on his leg is not healing properly. He appears to have swollen gums and coiled hair surrounded by small hemorrhages and bruising on his legs. His vital signs include a heart rate of 104, respiratory rate of 18, blood pressure of 108/70, temperature of 37.2 degrees Celsius, and 98% O2 saturation. Blood is drawn for lab work and the patient's CBC shows a hemoglobin of 8.8. Which of the following is a common risk factor for this patient's condition? A. Long-term IV nutrition. B. IV drug abuse. C. Isoniazid use. D. Lactose-free diet. This patient is a 47-year-old male presenting with impaired wound healing. Additionally, this patient has swollen gums, coiled hairs, perifollicular hemorrhaging, and ecchymosis. Vital signs are relatively normal except for slight tachycardia. This patient's CBC shows low hemoglobin, which when paired with his slight tachycardia and lower blood pressure, shows that this patient is anemic. This patient's symptoms of impaired wound healing, swollen gums, coiled hairs, perifollicular hemorrhaging, ecchymosis, and anemia should make you think of scurvy, which is a vitamin C deficiency. Some of the most common risk factors for scurvy are malnourishment, drug or alcohol abuse, older age, and patients with chronic illnesses. Therefore, answer choice B, long-term IV drug use, is the correct answer. Answer choice A is incorrect because long-term IV nutrition is a known risk factor for the development of a vitamin B7 or biotin deficiency. Answer choice C is incorrect because isoniazid use is a known risk factor for the development of a vitamin B6 or pyridoxine deficiency. Answer choice D is incorrect because a lactose-free diet is a known risk factor for the development of a vitamin B2 or riboflavin deficiency. And that concludes our lecture on water-soluble vitamins.